tonight, right away.
Tyrese is so competitive.
Pacers Tyrese Halliburton ruptured his Achilles tendon.
On the same court, in the same spot.
There's been an alarming amount of Achilles injuries and ruptures in the NBA.
I think in Game 6, he had pain already in the ankle area back then, and there were reports that it's probably Achilles tendinitis already. So that could be a premonition that it might happen in the next game. I'm Carlo Borbon. I'm from MakatiMed. I'm an orthopedic surgeon. I specialize in sports medicine and foot and ankle surgery. Achilles tendon is basically the tendon that connects the muscle of the calf to the foot. The purpose of which is to lift your heel up. So all of the movements that you use when you walk, when you run, you need your Achilles tendon. And when it ruptures, you lose that motion. Nawawala yung lift-off or yung pag-angat ng paa. So ang pwede mangyari, patients will still be able to walk. Yun nga lang, mawawala yung most natural motion ng galaw ng paa nila. They will also have a hard time jumping or just doing tiptoe movements. You will need for you to have yung natural gait natin or yung natural na lakad. Marami kasing tendons na tumutulong para magalaw ang paa, But the main power para makapag-tiptoe ka or para maitaas mo yung heel will come from your calf muscles. And ang magkoconnect yung calf muscles mo sa paa mo would be the Achilles tendon. So siya yung parang rope na humihila dun sa heel natin. If you will look at the function of the tendon, the anatomy of the tendon, hindi lang siya simpleng diretso. It's like in a spiral manner, So, for you to be able to jump high, or to do a sudden jolt, from standing to doing a side step, you will need that spring motion. So, the Achilles tendon is like a spring. Kaya, it's more common na pag meron kang spring-like action, mas nangyayari siya. As compared to, let's say, a long-distance running or marathon, which is not common. Most common cause for probably recreational basketball players would be siguro lack of training or lack of stretching, But when it comes to elite athletes or professional players, it's just yung explosive motion of basketball or any other sport. Hindi lang naman sa basketball yan common. If you will look at studies, ang normal walking would be, sabihin natin 100% yung load na pupunta sa Achilles tendon. But when you run, it can reach to about 200 times, But when you do sporting activities, it can reach to about 800 times. So if you look at how players move in basketball nowadays, all of them are very athletic, very agile. So yung mga mismong pivoting or sudden sidestep can cause it to rupture suddenly. Hindi naman natin masasabi na hindi sila toned, hindi sila trained. Kasi we assume that they're very well trained kasi they do daily activities, daily training. So I think it's just a natural explosive motion sa basketball. Kaya nag-rupture siya. It runs in every elite sports talaga. Basta meron ka nung sudden movement, sudden jolt, it can really happen. It's just that I think here in the Philippines, very sensationalized ang basketball. Kaya mas sanay tayo nakikita basketball players. There are conditions that footwear may play a factor, Like for example, there are people that are born with a shorter limb compared to the other. Siyempre, putting some orthotics will help that, Meron din people na they are born with sometimes a congenital deformity on the bone na if you have a hard surface on the back of the heel that can cause it to irritate the tendon. But it's not in general. So walang kinalaman ng footwear. It's more of the training of the tendon itself and the conditioning of the tendon. Natural healing, whether you treat it conservatively, meaning no surgery or operahan mo sila, average healing of tendon is about 6 to 8 weeks. The only problem is the rehabilitation. So it takes a while. Naturally, for you to have a normal gait, normal walking will be maybe about 2 months or 3 months. So that's the time na nag-start pa lang silang tumakbo or tumalon. But when it comes to elite sports, no, like for example, an NBA, usually they'll be off for 1 season talaga. Kasi you have to train them again to be as explosive as they are prior to the injury. So sometimes 9 months to a year talaga ang minimum. I think a big factor here would be siguro the rehabilitation, no? Sometimes the age plays a factor too. The younger you have it, mas magiging chances mo to recover back to your natural self, no? But yun nga, if you look at the history of patients before you had ruptures, no? Like for example, classic Kobe Bryant. After that Achilles tendon injury, he was not able to go back to his previous form. But if you look at, let's say, Kevin Durant, no? He had a rupture before, but he still played well. So it really depends on the type of play the patient has, no? For example, like in Kevin Durant's game, no? He's more of a shooter. So it does not really affect it that much as compared to someone who drives and slashes. As far as protective accessories are concerned, wala. Maybe it's just proper conditioning of your body. We would assume all NBA players has proper conditioning already, no? But it can still happen. So usually, the most sound advice would be if you feel something on your tendon, consult your doctor right away. Kasi most of this naman, they will have some sort of pain or discomfort at the start, and then they still try to play it, kaya nagkakaroon ng sudden rupture. So, consult your doctor right away if you feel something off in your foot. Tendons are usually more flexible when we are young, and we lose that elasticity as we grow older. Siyempre, when it comes to rehabilitation, the younger you are, no, the faster the rehab is compared to someone who's old. Usually, mas bata, less prone naman talaga, no? But as I said earlier, no, there's really no way to prevent this from happening kasi it depends on how explosive you are with your game. Siyempre, if you're an athlete or if your kid is an athlete, you won't stop them from being the best they want to be, no? So, siguro just proper conditioning. If you feel something different, consult your doctor. Because sometimes just a simple rest will make a big difference in recovery. Because even simple walking, simple running, no, you have some small injuries on your tendon na the body will try to recover by itself. So, siguro proper rest lang, proper hydration, proper nutrition is good enough to at least lessen the risk of ruptures. Even regular persons without any sport, that can still happen, no? Sometimes, common dyan would be yung biglang napa-hyper dorsiflex yung paa. So if this is your foot, if it was hyper dorsiflex like that, it can happen, no? So minsan yung nadudula sa hagdanan, napakyat, na suddenly biglang napa-overflex yung paa mo, that can happen, no? Meron yung iba na uhulog sa kanal na nag-rupture din yung Achilles tendon. So, as long as you have that sudden dorsiflexion motion, no, or umakyat yung paa mo, pwedeng mangyari talaga siya. MakatiMed offers wide variety of orthopedic surgeons, no, especially sports doctors. So, we have specialists in shoulder, in knee, in foot and ankle, in hand. If you have any problems, just come over. We'll be able to assist you in whatever ailments you have, especially if it's sports injuries too.